Hey there, I'm Dr. Kaushik Shah, Austin Urology Institute, and I've got one of our awesome patients here who I am just seeing today. He's here about 8 weeks after his Urolift procedure, and he said, I am so happy, I want to tell your patients, tell people about it. So I said, let's go do that. So we plucked him out of the patient room and brought him in to talk to everyone about the Urolift. So tell me about yourself.
My name is Rod Ambrose. I'm 73 years old. For the past 18, 19 years, I've had some problems with benign prostate hyperplasia.
Right, BPH.
Did I say it right?
Yes.
And I came to Dr. Shaw because it didn't seem to be getting anywhere or doing any better.
Now, you were having issues with urination, like pushing to urinate, urgency and frequency, getting up a lot to urinate, and kind of like a slow stream, right? Exactly.
Very weak stream. It didn't seem like I was emptying like I should. Mm-hmm. Sleep was interrupted. It just felt lousy.
Right, right. And as I get older myself, I will tell you honestly, like I value my sleep a lot, like sleeping through the night. And I'm in my late 40s. I start to realize, man, if I push it, I may have to get up once at night to urinate. Sometimes it's hard to get back to sleep, and I think as you get older, disrupted sleep can really mess with you in the next day. Right.
Right, and coupled with that and having sleep apnea, I wasn't having good days. Mm-hmm. And I wanted to be more alive during the day, have more energy, and mm-hmm. I really wasn't getting a lot of sleep, and I was constantly having to go to the bathroom to urinate. It just wasn't a pleasant life form.
Right.
Or way to live.
And speaking of energy, you've got a lot of it, and I want to be about as energetic as you when I'm 73, and I mean that. You're a coach, right?
I am a coach.
Uh-huh.
Right now I'm the National Olympic coach for the French national team.
Yeah.
And I've been doing that by Skype. I'm supposed to sign a contract to go over there, but COVID's changed that a little bit.
Yeah, that's phenomenal. And and clearly you're not acting your age. You should be at home, retired on a rocking chair, and you're busy. And I really admire that. And I will tell you on that note, I've got a number of patients during COVID who usually are busy. You're traveling around, you're flying around, but this has allowed a lot of people just to be at home, just to kind of take care of a lot of these things. So when we're past COVID one day, you'll be up and at 'em and urinating great and doing a lot better, it seems.
I'll be moving around quite a bit.
Yeah. So it's a nice time to take care of things. Now, prior to this, remind me, were you on medical therapy, on any medicines or medications?
Right, I was taking one medicine for BPH and another medicine for spastic bladder.
Right.
I was diagnosed with that shortly thereafter a stroke I had in 2002.
Right. And the medications, which is a big thing for me, one of them, like the Flomax or Alfuzacin or Uroxetrol, that can drop your blood pressure a little bit. It can make you a little more tired. It can reduce ejaculate volume. So those are some of the side effects of that. And then the bladder spasm medicine we were just talking about, that can cause dry mouth, constipation. Some of them can increase your blood pressure. So if you do the rough math, in a 1 year period, now you're off of both of those pills. We just talked about that. That's 700 less pills that you have to take any given year, which is amazing.
I'm very happy about that because, as you said, the spastic bladder medicine was actually one of the most horrible constipative medicines I've ever taken.
Right.
And I kept thinking, well, I take a few for different things, but it shouldn't be like this.
Right.
And it was pretty bad.
Yeah. So I looked at my chart before I walked into the room to see you. Before we did the Urolift, you had retained about 100 cc's of urine in your bladder. But so you should, when you go to the bathroom, you should empty your bladder. You had 100 in there. Today there was 4 cc's. So you've basically improved your emptying of your bladder by almost 99%, which is great. And then another thing is we did something called an American Urologic Assessment Symptom Score. So 35 is the worst you could urinate, like if your symptoms are horrific. 0 is 0. Your symptom score was about a 14 prior to doing the Urolift. Today, it's 50 to 60% better, and that's just, I think, about 6 to 8 weeks after your procedure, so, which is pretty impressive, and you don't have to be on the pills anymore.
Right, and to be truthful, I'm feeling 100% better. I'm not exaggerating. I feel 100% better, and I, as you said, after the operation, it'll take some time, but each week it gets better and better and better.
Right.
And if you go by weeks or days, it's leaps and bounds now, and I do feel a lot better.
So by helping you, one of the Olympic, French team's coaches, we might have inadvertently helped the French Olympic team actually win gold in the next Olympics. Like we could have,
Well, this is their best team they've ever had in the world of Olympic archery. The top 3 countries are Korea, South Korea, France, and the United States. Not necessarily always in that order. And I feel honored to be that. But now I won't be afraid to go over there to coach them prior to the Olympics. I won't be afraid to go actually coach.
Right.
As before, I'll be worried about having to go to the restroom all the time.
Yeah, and patients of mine who travel a lot and for business, and you for what you do, is that would often mean, just imagine you're going to have to reload on all your pills before you leave. You've got to usually get an aisle seat on the airplane to keep, little things like that, right? To get up to the restroom. Sometimes people go into retention where they can't pee after a long plane or car ride. So, yeah, absolutely. I think this is great. So
yeah, and hopefully the medal count will be up.
I like it. Hey, thank you for doing this on the fly, and kind of caught you by surprise to do this video on the fly, so I really appreciate it.
Not at all. Thank you for performing the procedure and putting me where I am today with it. Thank you very much.
Awesome. Thank you.